Hi, I'm Dr. Kaylin Klie, and my specialty is perinatal addiction. I provide prenatal and addiction medicine care for pregnant women with substance use disorders.
I lived a fast life before I had her, and I was on oxys. Once I found out I was pregnant, I let the doctors know that I used and that I needed help with that, and I didn't know how to go about that.
Many women in pregnancy are highly motivated for treatment and welcome the resources and ideas for improving their health during pregnancy and beyond.
When I was in the doctor's office, I was nervous about them taking my baby away from me when I had her.
And so as healthcare providers, it's important for us to know the laws and protections around substance use for pregnant women. For example, there's laws that exist in Colorado that should a woman have a positive urine toxicology test in pregnancy or admit to substance use in pregnancy, that information cannot be used to bring a charge against her or incriminate her.
I actually found out I was pregnant while I was in detox. I ended up taking a urine test and it came positive, and I just freaked out. I couldn't believe that it was true. I didn't know what I was gonna do because I was homeless and I was living on the street and I was drinking so much.
I find that when I really listen to our patient stories and identify the substance use as the end result of a whole lifetime of experiences that have led a woman to that point, I have not only increased understanding of her needs and what would be best for her health care, but also increased empathy and compassion for a patient that sometimes at first glance is a difficult patient to care for.
And we're just trying to survive. It's a disease. That addiction is a disease. And like I say, if you don't live it and you've never gone through it or you've never seen a family member live that, you won't understand it. You won't. And you could be a doctor and you could specialize in this your whole life and still not know. If I could give any advice to any doctor out there, just come with respect, and because we're scared. We're scared.
Hearing people's individual stories helps prevent identifying patients in pregnancy with substance use as bad people or bad patients, when in fact these women want the same things that all women do, which is a healthy pregnancy and a healthy child.
Because I never want to be on drugs with having my baby, And I felt so bad that I was still using while I was pregnant. I found out when I was 4 months, so I was using for a while, But she came out just fine, and everything's going good now.
Patients are looking for providers like you and me to, first of all, open the conversation and create a safe space to discuss what's going on in their lives, whether that's substance use, mental health concerns, or other concerns. But by bringing up the topic of substance use ourselves, it allows our patient to engage and gives the message that this is a safe place to have a conversation.
I understand that doctors are busy, but it'd be nice to have one that would have had a heart-to-heart with me and asked me more in-depth questions about my alcoholism and how I was planning on dealing with it, or if there was any way they could help me deal with it, instead of just yes/no questions and checking them off.
I need you to listen to me. I need to tell you how I'm feeling and how we could, work this out. As I told my counselor, I'm scared to even go see him. I don't even want to deal with them, because I feel like they don't hear me out.
It's important for us as OB providers to familiarize ourselves with the treatment modalities that are used for women with substance use so that we can provide accurate and informed information about how their substance use treatment should interact with their OB care. We are already doing so many things right in caring for our patients during the prenatal period. By improving our skill set in caring for women with substance use disorders, it's adding enrichment to our already excellent prenatal care. We are all aware of the epidemic of substance use in our country right now, and by improving our understanding and ability to identify and refer for treatment, we can be part of the solution.
If it wasn't for my counselors, I don't know where I would be at today.
Here I am 3 months after with having my baby, and I'm so blessed and I'm clean, and I just came a long ways, and my baby's healthy. She's super active, and I don't know what I would do without her. I'm so happy and thankful for having her.
Thank you for taking the time today to learn more about substance use disorders in pregnancy and to listen to our patients tell us some of their story from a personal level. By increasing our knowledge and improving our skills in the care of this vulnerable patient population, we can be an instrument for change in this woman and her future child's life.